Hi, I'm Tim. I am the founder of Cancer Detection Clothing, wearable technologies that image the human body for cancer and pneumonia. The goal of our product is to allow you to put on clothing connected to your phone. The phone connects to the cloud, it images the body, and if you have a heart tumor or pneumonia is easier than cancer. Pneumonia is just fluid on one or two spots, your left or right lung. The reason I came up with this is my uncle got lung cancer. When he was on hospice, he asked me, I said, is there anything I can do for you? Yeah, come up with a way to detect lung cancer, because if this was breast cancer, I would have had a shot. But it's lung cancer, I'm gonna die. Do that for me, Timmy. 2 weeks later, we were putting him in the ground. Now, obviously, I didn't manage to save him in time. Unfortunately, a little bit after that, my father got pneumonia, which is fluid on the lungs. He got esophagus cancer, which they couldn't operate because of the pneumonia. He's gone. So it's kind of a personal passion. So what I came up with is a way to detect hard tumors and pneumonia in the body. I can't give away exactly how we do it, but the technology is available over the counter. You can go and buy the basic technology over the counter right now at Target and Walmart. The way it works, it's safe, it's FDA approved, it just hasn't been used for this application first. You want to go to the next one? Sure. We can skip over this one, that's personal information. Now, our partners are going to be, we're in talks with IBM. Watson has a health part that specifically works with hospitals. Our target market is going to be insurance companies, doctors, and if individuals want to buy in, great. There's a monthly subscription for unlimited scanning. But think of somebody that has cancer who's in remission. The current situation is, hey, great, you're cancer-free. Come back in 6 months, we'll give you an MRI. Hopefully, you don't have anything growing. If something starts growing the day after you walk out of the hospital, 6 months from now it could spread. Now guess what? You're back to where you started, or you could be stage 4, you could be terminal. This allows you for a monthly fee. You buy the clothes, your insurance company or you pay a monthly fee, you get unlimited scanning. It's like getting on a scale every day. It's 1 minute to scan yourself, it's stored in the cloud. If you're cancer-free on the 1st, 2nd, 3rd, 4th, 5th, on the 6th there's something. By the 10th it's growing, by the 15th it's doubled in size. Now you take that to your doctor, say, hey, I've got something in my left lung. It wasn't there on the 1st of the month, it's the 15th, it's doubled in size in the last 15 days. Why don't you order an MRI, please? Here's the data. We can track it. It wasn't there, now it's there. And since the beginning of the month, it's doubled or tripled in size. That should be enough to get you an MRI, which will get you and catch it early. We want stage 1, stage 2 cancer. Pneumonia, once again, is relatively easy. IBM has got the track record and they've got the technology to get this out and to get it into doctors and oncologists' hands quickly. Next one, please. We are working with NAMSA. It's an acronym, but what they are is they're a medical device testing company. They work with Johnson & Johnson. They work with Boston Science. What they do is one of those companies come up with a medical device, they test it and get it FDA approved. We've got bids from them to take the product, get it FDA approved. Once it's FDA approved, the oncologist can start using it, and we can start selling it in the United States. We are a lower level medical device company. Like the iPhone I'm being recorded on, that's kind of a medical device in the fact it can tell you how many steps you took, it can track a variety of things. But if the iPhone fails, you don't die. So it's in a different category than a heart valve would be. Heart valve fails, you pass away. This fails, you were no worse off than before you used it. So there's a different level, and it's non-intrusive, doesn't require surgery, so the FDA puts us at a different level. We expect for about $1 million in 18 months, we would have approval through our partnerships with these guys. They've been around for more than 20 years. They've had multiple devices established with the FDA and multiple high-end medical device companies. So we're working with them. It's not my credibility, it's theirs if this works or not. We've already had the meetings. They have a high likelihood of success. See what we've got next going here. Now, our target market is going to be your insurance company, your oncologist, or if you want to reach out and buy it yourself, unlimited scanning for cancer and any other diseases we eventually learn we can find is $20 a month. If you just want to scan for cancer, it's 10. Now, insurance companies buy in bulk, we will drop that price. So you have an insurance company with 5 million patients, 600,000 people a year get cancer. We view them as all of our potential clients through their insurance company. And that going forward, if we get the price point right, because this is basically cloud technology, we envision the insurance companies or the healthcare providers offering this as one of their base packages. So who saves the most money if we can catch cancer early? Your insurance company. We save your life, we improve health outcomes, but at the same time, if you're an insurance company that can catch it stage 1 or stage 2 versus stage 3 or 4, you're saving them $50,000 to $150,000. So would they part with $10 a month? I would think so, if it saves them a potential $100,000 a customer. How many customers do we have to detect early to make this a financially viable market for the health insurance company? Also, as a secondary client, there's going to be the cancer drug companies. If we can track your drug and have a better outcome because we're tracking the cancer or the remission of your patients, your success rate goes up as a drug company. So there's a goal or there's an advantage for them to work with us because we can track how their patients are doing with their particular drug. So we're really looking at big pharma and the healthcare industry. Now, I understand the world image of those two industries are what they are, but we are improving health outcomes and improving people's lives while driving down costs in a safe way and in a way people can opt in. Next one. Basic breakdown of the study, we look at $2 million on the high side, getting the patent fully approved, $250, marketing around $1 million. Our total need up front would be $5 million. I'm a very conservative guy. A lot of people do cash burns. I don't want to do cash burns. I'd rather be approved product, going to market with money in the bank and not have to go around to a second round. So anyone that invests in me understands something. I'm not going to waste your money. I'm going to spend it like my own. But we want to get to market as soon as we can so we can save lives, improve outcomes, and begin making money. Once this scales up, I think everybody with healthcare in the United States and around the world can benefit for this. And once we're profitable, we intend to offer it at a severe discount or a massive discount to the developed world, because as long as they have an internet connection, they can be scammed. People in Africa get cancer, people in Asia get cancer. We can help all of them. And because of the cloud aspect of this, we can do it very affordably, and that's our goal, is to eventually, in the near future, allow everyone in the world with an iPhone or a smart device to be able to use this technology. And that's about it. Questions? Throw anything at me. Harder the better, the more I learn.
Can I just interject? This is a great overview of everything you're doing. What kind of feedback, you just have a bit of time, what kind of feedback would be most helpful for you?
Put me in front of healthcare providers and drug companies that could be potential clients and prepare me for those meetings.
How about the group today? What can we do to help? What kind of feedback would be helpful?
Any questions? Just throw anything at me. I think I covered some of what's in the sheet, but if you've got anything else or anything on the sheet, let's go at it. Be specific.
I got a link, so I'm gonna look up your stuff, but I feel like clothing, it seems like it should be a nightwear because you can do a much simpler design and cover a lot of people with 1 or 2 styles.
Right.
And it's something that they don't have to wear out in public. I mean,
Well,
it's like.
is it an undergarment?
Yes,
Is
it
it all
has to
day?
be.
Undergarment?
It has to make, let's go back into the technical side of it.
Yeah.
It's got to make contact with bare skin at multiple points. So
Yeah.
you're getting a scan front, back, side. So we're getting the lymph nodes in the chest, breast cancer, lung cancer, ovarian, colon, testicle cancer. So we have to wrap you around in multiple sensors so we have multiple points of view. The more sensors that make contact with your body, the better the images.
What's the ideal duration per day?
It's about 1 minute a day to scan, and we'd like to, we're gonna do a monthly subscription and encourage everyone to do a scan a day. We could say a scan a month, but guess what? You miss a month, now you're 2 months in, next thing you know, you're 3 months in. If it's a daily habit, get in on the shower, put it on, scan yourself, take it off, put it back on the rack, or bring it to work and show it off. One way or the other, we just need 1 minute a day for the rest of your life.
So they're just putting it on, getting scanned, taking it off, generally?
Yeah.
Yeah. Okay.
And we use the phone in the ideal application, USB to your phone, connect to the internet, scan, done, we're all good. Reason for that is the battery in the phone powers the sensors in the clothes. and we also want to help grandma. Now, back to pneumonia real quick. Pneumonia is the leading killer of seniors and children around the world. It's a complicating factor. It's not necessarily the thing that kills you, but it allows the thing that kills you to happen, like my father's incident. But if you look at infants and seniors, now you take seniors, you don't want grandma calling you every day trying to figure out how to do the Bluetooth. You want to be able to plug and play. Once again, when you take kids, you can take a small child, put them in this, it's safe, you plug it in, phone powers it, a minute later, you know if the kid's got an allergy, they got a cold, or they got fluid on the lung. If they have fluid on the lung, that has to be died. You were talking about like a 3-week-old baby now. Why is it coughing? You can find out. You can image your baby safely before you take it to the doctor. You can image grandma safely and quickly, right at home. All she's gotta do is plug in the phone or you do it for her.
I'm not sure if I'm using the right terminology, what's like the false positive rate of like?
Don't have that yet.
Okay.
We will have that when we come out of testing with the medical device company.
So currently you're testing the product.
We're getting ready to do our FDA study. So this is, it's technically a medical device. This is not something I can prototype in a garage. And so we're hiring a professional company to do that. But that's what we're gonna use the money for.
Building on Alex's point, I would mention that earlier on.
Okay.
Because the whole time I'm thinking, at what stage are you? And this was common for the other presentations as well.
Okay, yeah. I'll put that in like the top 3 slides.
I just have like an oratory like
Right.
comment, just with the credibility bit, when you said that it's not your credibility, it's theirs if this fails, I just wouldn't say that.
Okay, I apologize for that. The point I was trying to make is, since nobody knows who I am, and you know, I don't necessarily have credibility for the idea, but you partner with IBM and you partner with a leading medical device company, and on the backside, they both say it's possible and it can work. We're not going off their credibility. But you're right, I could have phrased it a little bit better, but I'll
Yeah.
work on that. Thank you. That could cost me a deal, thank you. Anything else?
Should it be a clothing or just a set of detectors or indicators?
The nice thing about clothing is everybody knows how to properly put on clothing. The sensors, yes, they would technically work, but you'd have to put them on, you have to make sure they all have proper contact. When you're talking about sick people, you're talking about a wide variety of people in different stages of health. The simplest thing to do is put on a shirt, plug it in, put on underwear, plug it in, take it off, hang it up. We're trying to wrap you around in sensors with just tight clothing to make it comfortable but easy. And everybody knows how to put on a shirt.
It doesn't have to be fitted for an individual?
We're gonna use a spandex material along with a network of sensors embedded into it. So it's gonna be tight. We need multiple points of contact to bare skin in order for it to work. So it's gotta be an underlayer, it's gotta be your underwear, it's gotta be tight, and.
Do they have to shave any hair or anything like that?
No, that's not necessary. We're gonna have more than 20 sensors per outfit. So we're gonna have multiple points, and that's how we come up, and they're all gonna weave together for an image.
Is this an idea that you want to take through the workshop and develop?
Yes, absolutely.
Okay. Have you done any primary market research?
Some, I mean, you get
Okay.
600,000 people in the United States that have cancer. Globally,
That's more secondary market. I'm gonna challenge you to, my feedback would be, take this sheet,
okay,
create 2 or 3 sentences for next time,
okay.
look at the homework, and do 2 or 3 slides on primary market research. Actually, if you can go out and do some of this, or you've already done some of it, present it, and I think it gets to the point of credibility as well.
Gotcha.
Yeah,
I've got most of it done, it just wasn't, this was a slide I was playing with.
No,
the last
fair enough.
48
You just
hours.
wanna- yeah.
Anything else?
A great idea.
Thank you very
Well
much, I
done.
appreciate it.
Well done.
Any feedback? By the way, I'll give everybody my card. If anybody thinks of any more feedback in the future, feel free to call, email. It's all good. You can't hurt my feelings. You can just only make me better.
Under 15 minutes.
Thank you.